To very aggressively encourage the states to take Medicare fraud more seriously.
As we come on the air, a renewed push from Washington tonight to fight fraud. Vice President JD Vance issuing an ultimatum this afternoon, demanding every state detail how they're rooting out fraud or risk losing federal funding. Thanks for joining us on air and streaming live. I'm Julie Nelson.
And I'm Rena Sargentopoulos. Also part of the crackdown, an immediate moratorium on new hospice and home health care agencies nationwide.
It is the latest step from the federal level, arguing state leaders aren't doing enough. We have team coverage tonight, beginning with Gordon Severson breaking down the new plans and how it could impact Minnesotans. Gordon?
Anti-fraud task force has discovered an enormous amount of Medicaid fraud in California, specifically involving hospice and home health care. And part of that crackdown will include a nationwide freeze on new providers to make sure these fraudsters don't move somewhere else.
We've got a very big announcement today.
Wednesday afternoon, it wasn't Minnesota, but California that was in the crosshairs of Vice President JD Vance and his anti-fraud task force.
The federal government is deferring $1.3 billion in Medicaid reimbursements from the state of California.
A crackdown that will soon impact hospice care nationwide.
A third of all hospices, a third of all these programs in the entire country are in Los Angeles. Ask yourself, how is that possible? It's not. There are not that many people dying in Los Angeles.
Dr. Mehmet Oz, who leads the Centers for Medicare and Medicaid Services, says the administration has cut off funding to 800 fraudulent hospice and home health care companies around Los Angeles. And to prevent them from simply moving to another state, the administration is enacting a 6-month freeze on all new hospice and home health companies nationwide.
There will be no new hospices or home health care open in this country. If you have the program now, you can keep it. You can go to ones that already exist. We're not taking away any services, but there will be no new licenses granted until we can figure out a better way of working across government.
The Minnesota Network of Hospice and Palliative Care says this 6-month freeze could have a significant impact on hospice care in Minnesota, with leaders saying they're willing to work together to root out fraud, but they're also concerned that many rural communities already face a shortage of hospice care options, and more restrictions could make the situation worse.
Medicare program.
The vice president acknowledged these concerns, saying they are trying to limit the negative impact on Americans who rely on these services.
We want to work with you to eliminate fraud and make these programs last longer for the people who truly need them.
Now, within the last hour, I received a response from the Attorney General's office claiming that Minnesota already has a firm grasp on the Medicaid fraud situation here, with Keith Ellison saying his team has secured more than 340 convictions and more than $90 million in restitution since he took office. Within the last few minutes, we also received a statement from Republican Representative Kristen Robbins, who chairs the Anti-Fraud Committee. She is grateful that the administration is cracking down on fraud, and she argues many states, including Minnesota, are not being aggressive enough when it comes to prosecuting fraud cases.
All right. Thank you, Gordon.